Hello everyone, welcome to Pediatrics by Dr. Anand, and today we're going to talk about our beautiful topic of neonatology. The topic name is appraisal of newborn. As you know, this is unit 3. In the unit 3, in the outline, the first topic is appraisal of the newborn. In this appraisal of the newborn, the basic outlines topics which we're going to talk about are introduction, definition of newborn, what is a neonate, what is an infant, and then we have beautiful classification of neonates, and then we have purpose of assessment of neonates, and then we have physical characteristics of normal newborn. Every segment, every topic has been beautifully incorporated. You please try to give your best intention in this video, in this whole segment of pediatrics. My aim and my focus is that all of you should able to understand every single word of pediatrics whichever I'm teaching you. Okay. Very good. And also, now, before starting, the motivating quote, which is very famous in my segments, the motivating quote for today before starting this topic is, don't lose hope. Don't lose hope. You're going to clear the exam. You're going to clear every single exam of your life. Don't lose focus. I know right now it's tough. I know you have to study so many subjects and you have to clear them well. It's difficult. It's very challenging. Don't lose hope. Don't lose focus. You are self-sufficient. God has made you enough to be brilliant in life. So don't lose hope. And I want all of you to put your best positive energy in this topic, in this session. Right now, you're sitting at your home, at your library, at your college, office, anywhere. Try to have the best positive, happy intention while reading this topic, so that once you put your best intention, the topic becomes automatically very simple and very beautiful. That's why. Okay, very good. Okay, today's topic of choice is neonatology. In the newborn care, there are some important definitions which you must know. Okay, the important definitions which you must know in a case of neonates is, number one, what is a neonate? What is a neonate? That's a very simple question which every one of us asks to each other. What is a neonate? So please remember, a newborn baby which is usually born, that newborn baby from 0 to 28 days of life, from 0 to 28 days of life is known as a neonate. Okay, or you can say neonatal period. Okay, neonatal period. Are you understanding? A delivery has happened, a newborn baby has just born. That newborn baby is known as a neonate. For how long this newborn baby will be called as a neonate? Till 28 days of life. Till 0 to 28 days of life will be a neonatal period. Are you understanding? Very good. This neonatal period, it is divided into early neonate and it is divided into late neonate. Early neonate and late neonate. What is early neonate? The babies which are born the beginning 7 days of life. 0 to 7 days of life is nothing but a early neonatal period, or known as early neonate. Okay, 0 to 7 days of life will be called as a early neonatal period. What is late neonate or late neonatal period? You can say after 7 days, or you can say 7 to 28 days of life. 7 to 28 days of life is known as late neonate or late neonatal period. So three important exam questions we have covered. What is a neonate? Baby which is born from 0 day to 28 days of life. What is a early neonate? Baby which is born from 0 to 7 days, that's 1 week, beginning 1 week of life. That baby will be called as a early neonate. What is a late neonate then? Any baby born after 7 days of life till 28 days. So 7 to 28 days, or after 7 days, if you're saying that, I can say 8 days to 28 days also. Both are same things only. 0 to 7 days is the early neonatal period. After 7th day till 28 days of life will be late neonatal period. Are you understanding? Yes or no? Am I making sense? Okay, you have to study in a very happy, positive manner. Okay, no stress in life. Life is really beautiful. Okay, after 28 days of life, after 28 days of life, what do you call that baby? That baby after 28 days of life, so you can say 28 days onwards till 1 year, that baby will be called as a infant. That baby will be called as an infant. Okay, from 28 days onwards till 1 year, that is called as an infant. Okay, and then after 1 to 3 years of life, 1 to 3 years of life baby is known as a toddler, is known as a toddler. Okay, and then sir, 3 to 6 years of life, a baby who is from 3 to 6 years of life is known as a preschool age period. Preschool age, 3 to 6 year of life. Okay, and 6 to 12 years of life, any idea? 6 to 12 year of life is known as a school age period. School age going period. Are you understanding? These all are the various periods of growth. These all are various periods of growth. I'll repeat again. Neonate, what is a neonate? 0 to 28 days of life is a neonatal period. 0 to 7 days is a early neonate. 7 to 28 days, or you can say 8th day to 28 days is late neonatal period. Okay, what is an infant? Till 1 year, like till 1 year, 28 days to till 1 year is nothing but an infant. What is a toddler? 1 to 3 year is a toddler. What is a preschool? 3 to 6 year old teens, 3 to 6 year old baby, that range is a preschool age baby. 6 year to 12-year old baby is a school going age baby. School age. Are you understanding? Please remember, wherever I'll be putting a star mark has been a recent exam question. Early neonate was the exam question. Infant is still how many years is an exam question, and school age period has been an exam question, theory questions. Okay, so this is very important, you must know them. Okay, very good. You have to study in a very happy way. Okay, in a very positive way. Like whatever I'm teaching you, don't like learn here only, revise here only, re-revise also here only. Don't have this theory that this video will get over and then you'll, in the night you'll revise again. No, learn, read, revise, then and there only, finish. That's it. Okay, very good. After the school age period, after the 6 to 12-year old, which is the school age period, we have something known as, I'll change the slide, we have something known as adolescent period. Adolescent period. Okay, adolescent period. Please remember, adolescent period is divided into early adolescent, middle adolescent, and late adolescent. Early, middle, and late. Okay, adolescent period is divided into early adolescent, middle adolescent, and late adolescent period. Please remember, 10 to 13 years of life, 10 to 13 years of life is a early adolescent period. 10 to 13 years of life is a early adolescent period. 14 to 16 years of life is a middle adolescent period, and 17 to 20 years of life is a late adolescent period. Late adolescent period. Okay, and please remember, this is the latest updates. In previous book it was 17 to 19 years of life was the late adolescent period, but the latest Opie and Nelson, they have told 17 to 20 years of life is a late adolescent period. Are you understanding? And star mark, early adolescent period has already been an exam question. Are you understanding? Yes or no? Very good. So these are very wonderful questions we have covered. Okay, I'll repeat again. We are studying neonatology. The subtopic, we are studying unit 3. In the unit 3, the segment number 1 is appraisal of the newborn. In appraisal of the newborn, we study basic definitions. What is a newborn? What is a late neonate? What is a toddler? And I have told you everything in detail. Okay, very good. Coming to the next slide. Okay, let's fine. So infant, toddler, preschool, school, these all questions we have already covered. Next question, which is the most commonest cause of neonatal mortality in India? That has been an exam question recently. Okay, theory as well as a practical clinical viva question. Which is the most commonest cause of neonatal mortality in India. In India, why neonates are dying, which is the most commonest cause. So, what do you think? Why neonates are dying in India? The most commonest cause of neonates dying in India is nothing but complications of prematurity. Complications of prematurity. This is the most commonest cause of newborn dying in India. Are you understanding? You don't have to cram, okay? No cramming business, please. Only understanding the concept. See, more the baby is premature, the more chances are there that the baby can expire. So, complications of prematurity is the most commonest cause of neonatal mortality in India. Why, sir? Why more the baby will be premature? Why the baby can expire? Because more the baby is premature. Premature means are you nothing but preterm. Premature means preterm, right? What is a preterm pregnancy? Any idea? A baby who has just born, he's a preterm. If I say, what is preterm? Less than how many weeks is a preterm? So please remember, less than 37 weeks baby, if he has born in this world. If he is less than 30, mother is pregnant but mother delivered a preterm child, means the mother period of gestation was 36, 35, 34 weeker. Are you understanding? Less than 37 weeks period of gestation a baby has born, that is known as a preterm. So more the baby is preterm, why there is chances that baby can expire? Any idea? Because more the baby is preterm, the baby's lungs, yes or no, the baby's lungs have not matured properly. Are you understanding? Naturally, the more the baby is preterm, the lungs have not formed properly. The lungs have not formed properly, and lungs in lungs. What are you trying to say in specifically in lungs? Something known as surfactant. Okay, surfing something known as surfactant. Surfactant basically it is present in the alveoli of the lungs. This is the alveoli of the lungs, this one. So in the alveoli over here, okay, so basically surfactant is present in the alveoli of the lungs, number one. Number two, what does surfactant do? It helps in keeping the alveoli patent. What is patent? Means it helps in keeping the alveoli open. Are you understanding? Again, listen to me, look at me. If you're feeling sleepy, have a coffee. Sit, relax your mind. Don't take stress. It's an easy topic. Try to chill. Try to talk to me, while looking at the video. Okay. So what are we talking? Neonatology. Which topic? The subtopic is the appraisal of the newborn care. Okay. What are we studying in that? I just now told you the most commonest cause of neonatal mortality in India is complications of prematurity. The more the baby is premature means preterm. Preterm is less than how many weeks? Less than anyone? Less than 37 weeks. Star mark, wherever I'm putting a star mark has been a theory question. Okay, so preterm is less than 37 weeks. So more the baby is preterm, the baby's lungs have not matured. For maturing of the lungs, what do you need? We need something known as surfactant. Okay, something known as surfactant. So where is surfactant present, sir? Surfactant is present in the alveoli of the lungs. What is the function of surfactant, sir? The function of surfactant is basically it helps in keeping my alveoli of the lungs open or patent. Done, finish. So naturally, more the baby is preterm, there will be surfactant deficiency, right? Surfactant deficiency, and if there is a surfactant deficiency, what will happen to the alveoli? Alveoli will collapse, will not be patent. Yes or no? Natural si baat hai, it's very natural. Alveoli will get collapsed. If alveoli will get collapsed, the baby will have distress. Yes or no? The baby will have a fast breathing. Yes or no? Very good, very good. Okay, done. Are you understanding? This is a very beautiful way of presenting the whole topic. And there was an exam question that when are you expecting the surfactant in the lungs in a newborn baby and in the amniotic fluid? When are you expecting the surfactant in the amniotic fluid in the mummy's tummy And in the baby's lung, when are you expecting? So please remember, you expect the surfactant to be there in the amniotic fluid at 28 weeks of life. A mother who is pregnant, he has a fetus, a baby, right? What is fetus? 9 weeks till birth is known as a fetus. So that mother, by 28 weeks period of gestation, the surfactant will start come in the amniotic fluid. And please remember, by 33 to 35 weeks of life, you are expecting the surfactant to be in the lungs. Okay, it's an exam question. It's a theory as well as clinical question. You are expecting the surfactant in the amniotic fluid by 28 weeks and in the lungs by 33 to 35 weeks. So naturally, any baby who is less than 35 or 33 weeker will have is more prone for distress because lungs have not formed properly. Yes or no? Right? So that's what you need to know. Okay, done. Perfect. Next. Finish. Yes. Now listen very carefully. Now listen very carefully. I told you the most commonest cause of neonates dying in India was complications of prematurity. That I've already told you, right? The other important causes, the top three important causes of neonates dying in India. Number second cause is systemic infections, and third important cause is nothing but perinatal asphyxia. Perinatal nothing but is like, some book says perinatal period is nothing but 22 weeks period of gestation, 22 weeks period of gestation to 7 days after birth. 7 days after birth. That is known as perinatal period. Okay. So please remember, there is a perinatal asphyxia. Okay. Or you can also say it birth asphyxia. Because of birth asphyxia, the baby can die. Yes or no? Neonatal mortality. Why sir? Why the baby will have asphyxia in the mummy's tummy? Why it can have? Have you heard of cord around the neck? Cord around the neck, like umbilical cord around the neck. Gynae people, they tell to the pediatrician, sir, we have to get the baby out because there is a two loops around the neck or three loops around the neck. So more strangulation, the more the baby will not breathe, lead to birth asphyxia. Yes or no? The bottom line is, the commonest causes of neonates dying in India are: number one, complications of prematurity; number two, infections, any sepsis, any systemic infections; and number three, very important, perinatal asphyxia or birth asphyxia, any insult to the baby during the baby was there in the mother's tummy, mother's womb. Okay, that's what you need to know. And other, yeah, these are the important causes of most commonest causes of neonatal mortality in India. Other causes, if you want to know, it can be measles, it can be any trauma, it can be diarrhea actually, it can be pneumonia as well, it could be congenital malformations. That's it. These are the other important causes of neonates dying in India. Okay, neonates dying in India. Okay, very good. Done. Next. Segment, the second part. So the topic is neonatology. The unit is unit 3. The subtopic is appraisal of newborn, and there just now we covered some important definitions of newborn and the most commonest causes of neonatal mortality in India. I hope you are with me. Okay, be strong. You have to have faith in you. Don't just watch me or this video just for the sake of passing. Accept pediatrics, accept this topic, accept it. Once you start accept and listen to me, then you will remember forever. If you just listen just like that in a haphazard way, then your marks also will be like haphazard only. You have to dedicate and just accept the subject and put pediatrics inside your soul, like hypothetically imagine, like newborn is there, what is infant, what is toddler. In the last video we just covered, right? Preschool, school. So try to have a hypothetical memory and be strong, you will get it, you'll get wonderful marks. You just have to be positive in life. Being positive is the key. Okay, even though you think it's very tough, say no, it's very easy. No, no, ho jayega, it's easy, it's easy. The 10th time if you say easy, 11th time it automatically becomes easy. Okay, very good. So next topic or the next segment, we have classification of neonates. In this video, we're going to talk about classification of neonates. How do you classify neonates? Very important. Point number one, neonates are classified according to birth weight. Neonates are classified according to gestational age. And neonates are classified according to birth weight and gestational age together. Are you understanding? Okay, so you classify neonates according to what you call birth weight and also according to gestational age, and then you classify according to birth weight and gestational age. How, sir? How are you able to classify? I'll tell you. So the classification based on birth weight. So what is the normal weight of a newborn? Any idea? What is the normal weight of a newborn? Please remember the normal weight of a newborn is 2.5 to 4 kg. 2.5 to 4 kg is the normal weight of a newborn. Recently, I had a class in Jaipur. I asked the same question to the students. Someone was saying 2.8 kg, some said 3.2 kg. So, this was the same answer I used to give in my internship time, but I got very bad scoldings from my HOD. So, to always have a range, the answer is always have a range. If I say 3 kg is the normal weight of a newborn, so my HOD said, okay, 3.1 is not normal, okay, 2.95 is not normal. So always say a range. 2.5 to 4 kg is the normal birth weight of a baby. Are you understanding? Okay, any baby who is born less than 2.5, any baby who is born less than 2.5 is known as LBW. What is LBW? Any idea? Very good. Low birth weight baby. Low birth weight. Any baby who is born less than 2.5 kg is nothing but low birth weight. Low birth weight baby. Okay. Then we have something known as less than 1.5 kg and less than 1 kg. A baby who is born less than 1.5 kg will be called as VLBW. What is VLBW? Very low birth weight. Okay, one is low birth weight, that is weight less than 2500 grams or less than 2.5 kg. Any newborn having weight less than 1.5 gram is very low birth weight. Okay, and any baby whose weight is less than 1 kg will be known as ELBW. What is ELBW? Extremely low birth weight. Extremely low birth weight is the known as weight less than 1 kg. Weight less than 1 kg. Are you understanding? Yes or no? Very good. This was the classification based on the birth weight. Okay, done. Next, we have classification based on the gestational age. Gestational age. The classification based on gestational age, it is divided into something known as preterm, term, and post-term. The classification of the neonates according to gestational age is divided into preterm, term, and postterm. What is preterm pregnancy? What is preterm? Any idea? Less than how many weeks? Just now I told you 3 slides back. So less than any baby who is born less than 37 weeks is known as a preterm. Any baby less than 37 weeks is a preterm. And what is a term pregnancy? 37 to 41 completed weeks. 37 to 41 completed weeks is known as a term pregnancy. And any baby who is more than 42 weeks old, any baby who is more than 42 weeks old is known as post-term baby. Okay, preterm, term, post-term. Less than 37 weeker, preterm. More than 42 weeker baby, post-term. What is a term pregnancy? 37 to 41 completed weeks is a term pregnancy. Okay, are you understanding? I hope it's not very difficult to understand. Okay, what are we studying? Neonatology. Which topic? Classification of neonates. Okay, and classification based on birth weight we have done. Classification based on gestation age I have told you, and classification based on birth weight and gestation age together. What is that classification? Very important exam question, I'll tell you. Okay. Okay, classification based on gestational age and birth weight together means if I plot a graph, this is the birth weight, this is the gestational age. So what are we studying? Classification of neonates. One classification is based on gestational age and birth weight. Okay, so if I put two plots like that, so any baby, so remember one thing, this gestational is right, so I'll write 34, 35, 36, 37, and birth weight 0.5 kg, 1 kg, 1.5, 2, 2.5, 3. Okay, are you understanding? There are these two lines are the centile. One is 10th centile and one is 90th centile. Okay, are you understanding? So for example, a pregnancy has happened, the baby is a term baby and the baby is 2.5 kg. Example I'm giving you. So 2.5, if I draw a straight line from 2.5 and baby is a term pregnancy term, if I draw a straight line like that and like that, are you understanding? So a 37 weeker baby with 2.5 kg. So can you see that this baby is coming between the 10th and 90th centile? So, and you think, right, that a term baby 2.5, 2.6 kg is appropriate, right? Is normal of a baby, right? What's the normal weight of a newborn? 2.5 to 4 kg. So at 37 weeks of life, a baby having 2.5 kg is almost appropriate. So a baby, is this baby will be known as AGA. What is AGA? Appropriate for gestational age. Appropriate for gestational age. What, how do you define it? So weight for age between 10th and 90th centile. This is the weight, this is the age. So weight for age between the 10th and 90th centile is known as appropriate for gestational age. And if one more pregnancy has happened, the baby is same 37 weeker, but this baby is only, imagine, 1.5 kg. Full term pregnancy has happened, 9 months 7 days, full proper pregnancy, but this baby is only 1.5 kg. Normal, how much this baby should be? 2.5 to 4 kg. So let's plot a graph. If this baby is 1.5 kg, if I draw a straight line and this baby is 37 weeker, so can you see that this baby is coming below 10 centile? So please remember weight for age. Any baby coming with weight for age below the 10 centile. This whole is the, yes or no? This whole is the 10 centile. So please write weight for age less than 10th centile is known as SGA. SGA. What is SGA? Any idea? Small for gestational age. Are you understanding? So weight for age less than 10 centile is small for gestational age. Weight for age between 10th and 90th centile is large for gestational age. And weight for age more than 90th centile, if the weight for age is more than, so I'll write weight for age more than 90th centile. So this baby is large. For example, a pregnancy has happened. This baby is 4 kg. 4 kg. Term pregnancy, okay, 37 weeker. This baby is 4 kg. Where is 4 in this plot? If I plot a graph 3, 3.5 and 4. If I draw a straight line like that and a straight line like this, are you understanding? Yes or no? So can you see that it is coming above the 90th centile? Yes or no? So weight for age more than 90th centile is large for gestational age. Okay, this is the, that finishes one classification of newborns based on gestational age and birth weight. Based on gestational age and birth weight. Okay, are you understanding? Very good. Done. Everything is done. Okay. Now listen carefully. Listen carefully now. So what is the normal weight of a newborn? I told you just now the normal weight of a newborn. Some book says 2.5 to 3.8 and some book says 2.5 to 4 kg. The latest guideline says 2.5 to 4 kg is the normal weight of newborn. Next question, what is the average Indian baby weight? This is a very simple and smart question. You must know what is the average Indian baby weight. See, average has to be 1. So please write average Indian baby weight is 3 kg. Average Indian baby weight is 3 kg. Are you understanding? Very good. Okay, and then something was low birth weight, very low birth weight, and extremely low birth weight. Yes or no? Low birth weight is less than 2.5 kg. So if the low birth weight is less than 2.5 kg, this is known as mild risk neonate. Mild risk, natural, right? 2.5 to 4 kg is the normal weight of a baby. So if the baby is less than 2.5, means this baby is kind of risk. The baby is at risk. Risk of what? Risk of going into prematurity, risk of lungs not forming properly, risk of distress, risk of infections. Yes or no? More the baby is preterm, the problems can happen. So low birth weight baby are known as mild risk neonates. Very low birth weight baby are known as moderate risk neonates. Again, a star mark. It has been a theory question. Very low birth weight means weight less than new baby weight less than 1.5 kg. These babies usually come under moderate risk neonate, and this babies very low birth weight is usually babies are less than 33 weeker, okay. Next, we have extremely low birth weight. Extremely low birth weight means less than 1 kg. A baby less than 1 kg is extremely low birth weight, and these babies are very, very high risk babies. High risk of what? High risk of infection. And if I talk about weeks wise, a baby less than 28 weeker will be a high risk baby. Will be a high risk baby. Yes or no? So moderate risk, high risk. And please, moderate risk is less than 33 weeker. This has already been an exam question that you must know. Okay. And what is big baby or a large baby or a big baby? Nothing but any baby who is born more than 4 kg. A baby who is born more than 4 kg is nothing but a macrosomic baby or a big baby. This is a very important slide. This is a very important slide. Please remember this. Okay. Very good. Done. Everything is done. Okay. Now please remember, I told you. So what is preterm? Less than 37 weeks. Less than 37 weeks is a preterm baby. Yes or no? Now there's something known as extremely preterm. Extremely preterm. What is extremely preterm? Any baby who is less than 28 weeks old. Are you understanding? Means like a high risk baby. That is known as extremely preterm. Please remember there are some definitions. One is extremely preterm. One is very preterm. So extremely preterm will be baby who is less than 28 weeks old. Okay. Very preterm is nothing but 28 to 31 weeks plus 6 days. Are you understanding? I'll repeat again. Less than 28 week of if a delivery has happened, that baby is preterm, but that is extremely preterm. Okay. Any delivery which is between 28 weeks from 31 plus 6 days or weeks. So that baby will be very preterm. Extremely preterm, very preterm. Then we have moderate preterm. Moderate preterm. Moderate means 32 to 33 plus 6. Okay, you can't say 34 weeks, just 33 weeks plus 6 days. Okay, that is moderate preterm. Again, revise, keep speaking. Are you feeling sleepy? Have a coffee, sit, put water on your face, relax. Talk. What are we studying? What are we studying? Neonatology. Which topic? We are studying the normal preterm. What is preterm? Less than 37 week. What is extremely preterm? Less than 28 weeks. 28 to 31 plus 6 is what? That is very preterm. Then 32 to 33 plus 6 days baby born is what? Moderate preterm. And last is nothing but late preterm. Any baby who is born from 34 weeks onwards to 36 weeks plus 6 days. Okay. Why 36 plus 6 specifically? Because 37 becomes a term pregnancy, right? 37 to 41 completed weeks is a term pregnancy. So these are the important theory question which you will fill and write in the papers, and you will get marks for that. Okay, done. So this one, the thing which I told you, small for gestational age, appropriate for gestational age, large for gestational age. This is the 10th centile, this is the 90th centile, this is the weight of the baby, this is the age or gestational age of the baby. So weight for age, accordingly I've told you, I'll not tell you again, this is nothing but this is known as intrauterine growth charts. This is known as intrauterine growth charts. Okay, intrauterine growth charts. Very good. And also, as I told you, weight for age less than 10 centile is small for gestational age, 10th and 90th appropriate, and more than 90th is large for gestational age. This is one picture also which can go weight wise. For example, if the baby is, imagine 38 weeker. If a 38 weeker baby has born, he should be more than 2.2 kg. If the baby is less than 2.2 kg, that baby is small for gestational age. And that same term baby who is more than 4 kg, or a big baby or a macrosomic baby, that baby will be large or a big for the gestational age. This is like weight wise cutoff, if you want to say, if you want to understand. Okay. There was one question. A neonate at 40 weeks, 3.4 kg. A neonate has born. He is 40 weeker old, 3.4 kg. Okay, let's see. Can you see this 40 weeker over here? 3.4 means 3.4 over here. Yes or no? Okay. What will be the neonatal referred to as based on birth weight chart? So if I draw a straight line like that and 40 week straight line like that and put it here, so where it is coming? It is coming between the 10th and 90th centile. So this baby is AGA, appropriate for gestational age. Okay, next question. So now theory also I'm showing you, like we just studied the theory, and now side by side we'll do the MCQs also. I will ask you subjective questions also, objective questions also. Everything we'll try to cover it up in one go. Full term or small for date babies are at high risk of developing what? The baby who is full term or small for date. Small for date means small for gestational age, whose weight for age is between 10 centile, yes or no? This one, right? This one, small for gestational age. So the question is that the small for date babies are at high risk of hypoglycemia, intraventricular hemorrhage, bronchopulmonary dysplasia, and hyperthermia. So the answer is, in general, the answer is hypoglycemia. The babies, every baby who comes in NICU, in nursery, in our hospital, we always check the sugar of the baby. Okay, because these small babies, basically small for gestational age babies, they are usually having hypoglycemia as the most common problem. Okay. Next, in large for date babies, all viscera weight more than normal except. It's a good exam question. In large for date means big baby, any baby who is term pregnancy but is more than 4 kg, big baby. So question is, in that big baby, all viscera will be weight more than normal except. So please remember the brain. The size of the brain of a post-term baby, or you can say large baby, will be same. So all viscera weight more than normal, kidney, heart, liver, but brain will have the equal size. Okay, there is no. And okay, what is macrosomia? Recent question 2013. Macrosomic means big baby, right? Large size baby or a big baby is macrosomic baby. Big mouth, that is macroglossia. Large head, that is macrocephaly. Okay, big mouth, like instead of big mouth you can say large tongue. Actually large tongue is known as macroglossia. Large tongue, like in Down syndrome, large tongue, that is macroglossia. Large head, that is what we call macrocephaly. And macrosomia is big baby, large size baby. Okay. Yeah, and microsomia is defined as, see, one is macrosomia, one is microsomia. Macrosomia is big baby or large for gestational age, and microsomia is small for gestational age. And how do you define small for gestational age? Weight for age below the 10th centile. Birth weight below the weight for age below the 10th centile is small for gestational age or microsomia. Okay. Next MCQ, macrosomia is seen in all except. So a baby has born. A baby just now has born. He's having macrosomia. Macrosomia means big baby, heavy baby. Okay, heavy baby. So what is the cause that macrosomia is seen in what all conditions? See, if the most commonest, if the mother is obese, baby will be obese. If the mother is an obese child, baby will be obese child. Number one. If the mother has diabetes, of course, diabetic baby usually have are big baby because of the insulin. This it secretes insulin. Insulin is an anabolic hormone, so it causes big baby. Okay. So what are the causes of big baby? Mother having obesity, baby will have obesity. Mother having diabetes or multiparous woman. Multiparous women usually delivered big baby. Okay, so question is macrosomia is seen in all except maternal hypertension. If the mother is having hypertension, instead of big baby, her baby will be small for gestational age. So SG is small for gestational age. Okay, that's it. Hello everyone, welcome to Pediatrics by Dr. Anand, and let's continue our sessions of neonatology. So in the beginning part, we have covered the basics periods of growth. What is an infant? What is a toddler? What is a preschool? Right. In the second segment, we have covered the important topics of classification of neonates we have covered, which is very important. They have asked questions on what is appropriate for gestational age, and I told you that weight for age between the 10th and 19th centile is AGA, more than 90th centile is LGA, less than 10th centile is SGA, small for gestational age. Are you understanding? Very good. Okay, this question we have already covered. Macrosomia is seen in all except. So macrosomia, I told you, if there is a big baby, number one is mother having obesity. If the mother is obese, baby will be obese. If the mother is having multiparous pregnancies, then the baby can be obese. And diabetes, of course, can lead to a heavy baby or a big baby. Whereas hypertension, of course, will lead to a small for gestational age babies or a small baby. It compromises the placental flow, and it compromises the placental blood going to the baby, and that is why baby will be small or kind of small baby. Okay, done. Next important cause we have causes of LGA, large for gestational age. I told you as AGA, LGA, SGA. LGA we have to speak in detail, and before speaking, a wonderful quote again is on our way. Work hard in silence, let success make the noise. Work hard in silence. Don't tell everyone how much you are studying, how are you studying, what is your plan, and this and that. Just work hard. Just keep working. The success will automatically make the noise. Don't worry. Life is really beautiful. Life is, it's just amazing to live, So don't take stress, don't take tension, work hard. That's it. Just, and most importantly, nowadays, more than the hard work, it is the smart work which really means a lot. So do smart work and work hard in silence, and let success makes the noise. Don't tell everyone I'm doing this, I'm doing that, I will definitely clear, I have covered everything and this and that. No, tell them, yeah, I'm trying, ho jayega, it's fine, I think I'll do it, yeah, I think it's fine, this much, that's it. But work hard in silence, let success makes the noise. Okay, work hard, don't stop working hard. You have great potential. You guys are on a very fresh stage of life. You have a lot to achieve. You have lot to do. You have to feel your worth. You have to feel your presence. Just don't live for the sake of living. You need to have some reasoning of life, and one day if you get it, then there is no looking back. Okay, so work hard in silence, let success makes the noise. Okay, with this positive vibe, positive energy, let's start. The question is causes of LGA. LGA, what is LGA? As we all know, it is large for gestational age. Yes or no? And how do you define large for gestational age? I told you weight for age more than 90th centile, yes or no? So what do you think? What are the various causes? A delivery has happened and the baby is 4.5 kg. 4.5 kg baby is there. So what are the causes you can think of? In general, the causes of large for gestational age, the mnemonic, we have SBI Bank extra account. This is the mnemonic for large for gestational age baby. The mnemonic is State Bank of India extra account. S for Soto's syndrome, B for Beckwith-Wiedemann syndrome, I for infant of diabetic mother, and E for erythroblastosis fetalis. Erythroblastosis fetalis. These are the causes of large baby or a big baby. Account for, you can say C for constitutional. Constitutional mean you can say the obesity, like constitutional causes, mother having multipara. These all are the causes of large baby or a big baby. I'll repeat again, the mnemonic is State Bank of India extra account, S for Soto's syndrome, B for Beckwith-Wiedemann syndrome, I for infant of diabetic mother, E for erythroblastosis fetalis, and account C for constitutional, or in that means like physiological, or you can say the mother is obese, baby can be heavy, large. If the mother is having multipara, baby can be large again. Are you understanding, yes or no? Very good. Perfect. Okay. Next. Now coming to image-based questions. In your theory and clinical exams, we have a lot of image-based questions nowadays they are asking. Okay, so you must understand to get them also. So if I show you this baby, if I show you the picture of this baby, what can you appreciate? Again, you have to open your brains, okay? No sleeping, no getting tired while watching the video. Have an exciting mood, have a crazy mood, and then, study, okay? Because everything will make sense by the end of the journey. So please make your journey worth. Okay, so what can you see, bro? Tell me, anyone? So can we see a large tongue? Yes or no? A kind of a large tongue. Can I write here large tongue? What do you call it for large tongue? Have you heard of macroglossia? Number one. We can say macroglossia, right? Very good. Okay, next. Okay, what is this? Very good. So this is nothing but pinna, hair pinna abnormalities. Yes or no? What abnormality? I can see a fissure. I can see a fissure. Yes or no? This one. So earlobe fissures are there. Fissures are there. Okay. So I saw large tongue, macroglossia. I saw earlobe fissures also. I saw, and also there's a mother in these cases. This is a syndrome. Okay. I'll tell you the name later. I'm telling you the hints now, and then in the final I'll tell you the name. Okay. In this one also the mother is having a history of polyhydramnios. Mother is having a history of polyhydramnios. Okay. Polyhydramnios. So what all we discussed? We saw macroglossia, fissures over the earlobes, mother having polyhydramnios. Okay, again, earlobe creases. Can you see this crease? This one. So this one. So this earlobe is having various creases. Okay, creases. Yes or no? These all things coming in one syndrome. Okay. Okay. What is this? Any idea? Any random guesses? What do you think? Okay. Can you see again macroglossia? Yes or no? This one. So I'll write macroglossia number one. Okay, now listen very carefully. What is this, yaar? What is this? What is this? Any idea? So this is something known as omphalocele. Okay, omphalocele. What is omphalocele, sir? Can you see the intestinal contents are out in this one? Can you see that the intestinal contents are out, but they are covered in a sac? They are covered in a sac. Yes or no? So yes, the intestinal contents are out and they are covered in a sac. This is known as omphalocele. This is known as omphalocele. Intestinal contents are out, but they are covered in a sac. Okay. So in this baby, what all I can see? Sir, I can see macroglossia, I can see, kind of a pinna abnormalities, or you can see kind of earlobe creases also. You can see macroglossia. You can see omphalocele, very important. Okay, let's move further. Okay, in this picture only, can we appreciate that this side of the limb, this limb, is little bigger than this limb? Can we see that the right side, this part is little bigger as compared to this part? Okay, so what do you call this? I'll show you a better picture. 1 second. Okay, this one. So can you see that if I draw a straight line, can we see that this part of the limb is little bigger than the other part? So this is known as hemihypertrophy. Hemihypertrophy of limbs. Yes or no? So hemihypertrophy of limbs, right? So this also, so what all you see? So I can appreciate macroglossia, I can appreciate microcephaly. This baby's head also is small. Macroglossia with microcephaly with hemihypertrophy of limbs. Yes or no? Okay, with the baby is having omphalocele. So these all points come together with something known as Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome. One of the causes of large baby or a big baby, large for gestational age, yes or no? So yes, very important. We covered something today. We're going to talk about causes of LGA. What is LGA? Large for gestational age. Okay, the mnemonic was State Bank of India extra account, Soto syndrome, Beckwith-Wiedemann syndrome. B, Beckwith-Wiedemann. The points I've told you: Beckwith-Wiedemann syndrome, macroglossia, microcephaly, hemihypertrophy of limbs. The baby can have increased incidence of omphalocele also. Okay, are you understanding? Okay, and also the other things. See, in this one, let me tell you, in this one the intestinal contents are out, but they are covered in a sac. What about this picture? This one, what can you see? Can you see the intestinal contents are out, but they are not covered in a sac? Yes or no? Yes, the intestinal contents are out, but they are not covered in a sac. So this is known as gastrochisis. This is known as gastrochisis, where the intestinal contents are out but they are not covered in a sac. Whereas in omphalocele, the intestinal contents are out but they are, can you see, they are covered in a sac? Number one. Number two, omphalocele, in a case of omphalocele, you can also have liver or spleen. You can also have liver or spleen coming out in a case of omphalocele. You can also have liver and spleen coming out. Whereas in gastrochisis, you will not have liver or spleen coming out. It is just the contents. Okay. I'll repeat again. In omphalocele, in this sac, the liver and spleen also can come out. Whereas in gastrochisis, it will be only the intestinal contents which will be out. Okay. That's it. I'm telling the difference between gastrochisis and omphalocele. This is gastrochisis, this is omphalocele. In Beckwith-Wiedemann syndrome, you see omphalocele. You do not see gastrochisis. You see only and only omphalocele. Okay? Done. Very good. So what all I saw in this one. So please remember now extra points. Now listen carefully. This is an important theory topic. You need to get to the point of it. So very importantly, we need to know Beckwith-Wiedemann syndrome. Important points I have told you. These babies of Beckwith-Wiedemann syndrome, which are having omphalocele, these babies have a high chance of Wilms tumor. Patient suffering from Beckwith-Wiedemann syndrome, they usually have higher chances of having Wilms tumor. Okay, this one extra point you need to know. Please remember, there are some syndromes which are associated with Wilms tumor. Okay, I'll tell you the names later. Right now, you should know that Beckwith-Wiedemann syndrome is one syndrome which is in the baby can have umbilical hernia, and there is an increased incidence of Wilms tumor. Okay, done. So yes, I saw. So yes, you can say, so the important points, the extra points of Beckwith-Wiedemann syndrome, we have to go everything in detail. So that's why I'm putting the points. The important points of Beckwith-Wiedemann syndrome are: number one, baby can have Wilms tumor. Number two, retrognathia or micrognathia. These babies, I told you, macroglossia with microcephaly, and also they will have kind of a small jaw or a thin jaw. See this picture, this one, they will have a micrognathia or retrognathia. Micrognathia is small chin, or retrognathia is backward chin, small chin. Okay, number one. Number two, in this babies of Beckwith-Wiedemann syndrome, they are the large baby, right, or a big baby, right? So they will have hypoglycemia. The patient can have incidence of hypoglycemia because of the IGF-1 polymorphism. Because of the IGF-1 polymorphism, just the name you need to know, there is hypoglycemia in Beckwith-Wiedemann syndrome due to IGF-1 polymorphism. Okay, what are the other points patient can have? The patient can have axomphallos. Okay, the patient can have axomphallos. The patient are big, they are big, gigantism, large baby, big baby. Okay, and omphallos, axomphallos they can have. Okay, next, of course, visceromegaly, they can have visceromegaly. I'm telling you the extra points of Beckwith-Wiedemann syndrome. See, always remember, my HOD used to say photographic memory. Photographic memory is everything in life. Okay, so you see this picture, you saw the macroglossia, you saw the microcephaly, you saw the this retrognathia or micrognathia, hemihypertrophy of limbs. They can have increased incidence of Wilms tumor, these babies can have. Okay, and they can have, of course, gigantism, visceromegaly, lateral earlobe fissure. I have already shown you. Should I show you again? This one, yes or no? I told you this one is a earlobe fissure, so yes, lateral earlobe fissure these babies can have. Okay, and very important, I've told you microcephaly, that I have already told you. Star mark, it has been an exam question. Beckwith-Wiedemann syndrome could be a 5 marks theory question, you should know that. Okay, and microcephaly the baby can have. Microcephaly, what is microcephaly, anyone? Small head. Okay, small head. Please remember there's something known as microcephaly and something known as macrocephaly. Okay, microcephaly in a proper book definition which they have come in exam, you should know: head circumference of any baby, head circumference less than -3 standard deviation. Any baby, any child, any newborn with head circumference less than -3 SD. SD is standard deviation. So head circumference less than -3 standard deviation for the age and sex, for the specific age and sex. Like I'll have a patient for a specific age and sex. I will take the patient head circumference. I will open my book and I have a chart where I will correlate the head circumference for the respective age and sex in my book, and I will see whether it is coming to the normal range. Is it coming in -1, -2, -3 standard deviation? How much it is deviated? How much it is deviated from the standard? From the standard. So if the head circumference is deviated less than -3 from the standard for the age and sex, then I will say the patient is having microcephaly. And what is macrocephaly? When the head circumference is more than 2 standard deviation for the age and sex. For the age and sex, if the head circumference is more than 2 standard deviation for the age and sex. Are you understanding? Yes or no? Very good. Done. So yeah, these are exam questions. Please star mark. Okay, don't forget. Microcephaly exam question, macrocephaly exam question. Okay, so now you know microcephaly you see in Beckwith-Wiedemann syndrome. Done. Very good. And also, as you know, it is a large baby or a big baby. So this overgrowth syndrome is caused by mutation in the chromosome 11p15.5. 11p15.5. Very important. This is the mutation you see in this chromosome 11p15.5. This much only you should know. Okay, done. Very good. Yeah, it's easy only. Okay, next one. Yes, which three syndromes are associated with Wilms tumor? Just now I told you that in Wilms tumor, Beckwith-Wiedemann syndrome, of course, can have the patient can have increased incidence of Wilms tumor. The other syndromes with increased incidence of Wilms tumor are Denny-Drash syndrome, and WAGR syndrome. Denny-Drash syndrome, WAGR syndrome, and Beckwith-Wiedemann syndrome will have these are the three syndromes who are associated with Wilms tumor. Okay, that you should know. Okay, next. Hmm. In WAGR syndrome also, if talk about WAGR, the WAGR syndrome, if I talk about that itself, you should know WAGR, the mnemonic itself is WAGR, WAGR. Okay. Number one, the patient can have a Wilms tumor. I'll repeat again, WAGR syndrome, few important points. The mnemonic itself is WAGR. W4, patient can have a WAGR. The patient can have a Wilms tumor, that is nephroblastoma. The patient can have A for aniridia, A for aniridia, and G for genitourinary malformations, genitourinary abnormalities, and WAGR, R for retardation. So W A GR, okay, WAGR syndrome, Wilms tumor, aniridia, and what you call genitourinary abnormalities and mental retardation. Okay, mental retardation. These are the important points of WAGR syndrome. This much you should know. Okay, why we spoke about WAGR syndrome? Because we saw Beckwith-Wiedemann syndrome, and the similarity of both syndrome is they both have Wilms tumor. They can have Wilms tumor. Okay.